Welcome everybody, and thanks for trudging out in the snow and cold for this great event tonight. My name is Rodney Vanderwalker. I'm either the class of 2008 and 2007. We can't figure that out. But I was in the Health Policy and Management Division, and I currently work as the Vice President for Operations at Fenway Health, which is a federally qualified community health center which works to enhance the health of the lesbian, gay, bisexual, transgender communities, as well as those who live and work in our neighborhoods through access to high-quality healthcare, research, and training. And our main site is actually right down the street on Boylston Street, and we are open for new medical patients, if anybody's interested. So it is my great honor to introduce our new dean, Dr. Sandro Galea. So I had the privilege of meeting Dean Galea when he joined us for our alumni reception at APHA this year. And I have to tell you, not only is he warm and engaging, he is, in Boston speak, wicked smart. So Dean Galea trained as a primary care physician at the University of Toronto and practiced in rural communities throughout the globe, including northern Canada and Somalia. He then returned to academia and earned a master's degree in public health at another major Boston institution, and a DrPH at Columbia. So prior to coming to BU, Dean Galea was the Anna Chesky Skelman and Murray Charles Skelman Professor and Chair of the Department of Epidemiology at Columbia University's Mailman School of Public Health. His accomplishments and publications are numerous. So in 2006, Dean Galea was named one of Time Magazine's Epidemiology Innovators. He has served as president of the Society for Epidemiologic Research and an elected member of the American Epidemiological Society and of the Institute of Medicine. So if you get the chance, you should really look up some of the research or watch one of his TED Med talks, because you will immediately see why he was chosen to be our new dean. His work on the impact of context on biomedicine and his emphasis on the importance of population health fits perfectly with BU School of Health's mission and values. We are truly lucky to have him at BU and as a member of Boston's public health community. So with no further ado, please help me welcome Dean Galea.
Well, thank you, everybody. Rodney, that was really lovely. Thank you very much. He scared me before. He said he's going to say things about me, but that wasn't as bad as it could have been. I want to say thank you to all of you for being here. I'm still acclimatizing myself to Boston in the real sense, and today it's just really, really cold. So to have you all be here is really wonderful. It really is a privilege to be here. I am really honored to have this position, and it's really wonderful to be part of your community. I have admired what BU has done for a very long time, and I think this is a place that is motivated by, inspired by, and lives by an ethos that I really respect and would like to have in view how I live and how I work. I want to first thank Dr. Bob Meenan, who is the Dean of the school for 2 decades of leadership. And really, I think Bob built the school. The school is the school that Bob built, and I am immensely grateful to him for that. I think we all should be. And it is my job to help us now stand on Bob's shoulders. Luckily, Bob is very tall, so it's actually we can see very far by standing on Bob's shoulders. So I know that you all actually trained when Bob was dean, and I think he leaves a wonderful legacy, much of it being in this room. Let me tell you just a few things about myself, and adding a little bit to what Rodney said. So I'm trained initially as a primary care physician and an emergency physician, and then I drifted to academia through coming back to school. But the story of how I came to public health really comes from my primary care practice. So I worked all over the world, and in particular, I had a very formative year experience in Somalia, where I was working with Doctors Without Borders. And when I was in Somalia, I was there in 96, 97, which is, for those of you who are not up on your Somali history, is 3 years after the Siad Barre government collapsed. So Siad Barre was a dictator in Somalia for like 23 years in a typical way. Then he was ousted, and of course there was no government, there was no country. So the place really fell into a tremendous state of lawlessness. And I was there as part of Doctors Without Borders, and I was the only physician in a area of 350,000 people. And my job really was to run the hospital and to keep people alive. And I was pretty well trained as a physician. I had worked in northern Canada, I had worked in the Philippines, I had worked in Guatemala at the time. So I sort of knew what I was doing clinically. And I really felt like I was, saving lives every day. Like it's not I don't say this in a boastful way, it was just the truth. Like people would come and they were going to die, and then the physician, me, I would do things, and then they didn't die, right? So it was a really positive clinical experience. And I remember saying to myself, I am doing so much good for people. And I remember saying to myself, this is really dispiriting, because I just felt like the guy at this edge of the river, and I see this woman coming by and she's drowning, and I quickly get in the water and help her get out of the water. Then I get back on the shore and another guy comes down the river. I get out of the water, save him from the water. Then another woman comes down and save her from the water. And I felt like that's what I was doing the whole year, when instead what I should be doing was walk upstream and say, who is throwing these people into the river? And as a classic, I was a physician. I was trained as Rodney mentioned, University of Toronto, which was at the time and still is. It's a very fuddy-duddy old medical school, which means that I had no idea what public health was. I really did not know anything at all. But I had heard about it. It was like a word, like the way you hear about something that like your kids know about, don't know what it is. So I decided to go back to school to learn about public health. And now I'm here. But the reason I stayed in public health, and I have to tell you, my intention was when I went to public health school was to do a master's and then go back to practicing medicine. Rodney mentioned I did my master's at another institution in Boston. And now don't tell them this, or some of you here who happen to be faculty there, but the reason I actually went there is because it was the fastest way I could do a master's in and out. So I actually that was the extent of my dedication to public health. I don't know what this public health thing is, but I can learn it all in a few months and get back out and get back to medicine. So we all know how well that succeeded. But I stayed because I am deeply motivated every day by the mission of public health. Public health is about creating the conditions that make people healthy. And I can think of no higher calling. It is a real privilege actually to be part of that enterprise that is about creating the conditions that make people healthy. Because if we succeed, we are making sure that people are not thrown in the river to begin with. Now, there's always going to be some people who are going to slip through. That's why we need doctors. But we need them for downstream. What we ultimately want to do is make sure that we are upstream and making the world a far healthier place. Now, sometimes when you're working in public health, you're pretty far from all that, because what you're doing in your day-to-day basis is you're doing stuff and you're doing small things, and like, how am I actually helping anybody? But to do something great, it's complex. To do something big, it requires a lot of people. It requires a lot of us. So we are part of that enterprise. And that really is a great thing to wake up to in the morning, because I feel like we have the privilege of being in a business where we can really do well by doing good. And that is our intention for the school. Standing on the shoulders of the people who have come before me, my intention is to help us move to the next phase of who we are, to figuring out how can we best innovate on generating the knowledge that is going to inform how we create conditions to make people healthy. How are we going to innovate on transmitting that knowledge to the next generation of students? And how are we going to make sure we translate that knowledge so that the people in non-health sectors, the urban planners, the lawmakers, those who come up with taxes, the policymakers, are informed about what it means to make structural changes that make healthier populations. That is what I see us doing together. And that's why I'm really excited about this group here today. I think BU has a justifiably proud tradition of excellence in its alumni. And I think what distinguishes BU at this stage of its history is it is truly a top-tier research school of public health that also cares deeply and passionately about giving students a real-world public health education. And I think if we are very clear that that is who we are and that is what we do, we have a very bright future where we can actually do well by doing good. Because while there are many of our competitors, they all have their niches, but the intersection of being a top-tier research school that cares deeply about training students in real world public health is ours to embrace. And that is a noble calling, because I want to be part of a school that is innovating, generating knowledge, but also cares passionately that its students go out there and make the world a better place. I have been enormously impressed by the energy and enthusiasm about BU that its alumni have, which leads me to feel like this group really feels passionately about their school, and we are going to make sure that we have more opportunities for alumni engagement, because as we see it, the alumni experience is you're part of the school. Once you enter the school, you're part of the school, and we're going to make sure that we create more opportunities for alumni to both participate in the school, but also benefit from courses and things like that. All of that will be rolling out sometime in the next months and years. At the end of the day, I really look forward to many more conversations with all of you. It is, as I said, enormous privilege to be here. It will be even more of a privilege once it warms up a little bit more. But until then, I will take the privilege as it's served. Thank you all for coming out tonight. And I've really enjoyed talking with as many of you as I can. I look forward to talking with more of you and at other such events. Thank you. Rodney says we're done.